Hello, my name is David Douglas, and I'm the co-founder and CEO of Effective Law Enforcement for All. Our mission is in our name. We work with communities and the public to help them partner with police agencies and civic leaders to achieve a shared vision of policing practices that are safe and effective for police and the communities they serve. Our work was born out of our experience working with communities across the country. And one of the things we've learned is that the elements of safe, effective, and lawful policing are not a mystery, but all too often they are a secret from too many of us. Our mission is to educate the public and the police so that they can be equal partners in the ongoing efforts to achieve law enforcement that is safe and effective for all. We work with a team of policing experts, civil rights advocates, and academics who have worked with police agencies and communities across the country to reform policing practices so that police agencies can answer the public's expectation and demand for policing that is safe, effective, procedurally just, and lawful. And you can learn more about us at our website, www.ele4a.org. That's the number 4. As part of our educational mission, we are conducting this series of videos that we call our Academy series. And in this series, what we hope to do is educate you about some of the core elements of policing. In future sessions, we'll be looking at topics like use of force, stop searches and arrests, traffic stops, procedural justice, community engagement, and a range of others. But today, we want to discuss one of the most controversial and consequential challenges that face police. And that's responding to calls involving individuals who are experiencing a mental health crisis. We have all read too many news reports, seen too many videos in which encounters between police and individuals experiencing a mental health crisis end in tragedy. While no one can guarantee the outcome of any individual encounter, there are recognized ways to increase the likelihood that these encounters end safely for everyone, and that the individual gets the help they need. So today, we're going to learn from one of our experts, Julie Solomon. Julie is a licensed social worker who has worked with police agencies around the country on the issue of responding to mental health crises. She's going to explain the challenges police face when encountering individuals experiencing a mental health crisis, the recognized practices for effectively responding to these situations, and perhaps most importantly, what you can do in your communities to help ensure that your police department has the knowledge and the tools to respond safely and effectively to help individuals experiencing a mental health crisis. Julie, thank you for spending time with us today. Just tell us a little bit more about your background and your involvement in police practices and policing reform.
Thank you, David, and it's an honor for me to be here today. So as you said, my name is Julie Solomon, and I am a licensed clinical social worker by training. I've spent a number of years on the ground overseeing services that were at the intersection of criminal justice and behavioral health. Those services really largely involved police training, jail diversion programs, specialty courts like mental health courts, drug courts, 24/7, 365 crisis services that are really designed for law enforcement drop-off, which we'll talk a little bit more about later. So the last 10 years or so, I've been doing a lot of work with police departments around the country in this space, recognizing and responding to persons that are in mental health crisis. And so I'm honored to be here today and to talk a little bit more about that work.
Great. So let's just start at the basics. When we're in the context of policing, when we're talking about individuals in mental health crisis, what are we really talking about? And what are some of the challenges that those situations present to the police?
So I like to talk about mental and behavioral health crises in a much more broad manner, because law enforcement around the country are responding to crises not just mental and behavioral health crises, but when we think about people who are in crisis, we can define mental health crisis by things like there is a domestic situation at home where maybe spouses or partners are in an escalated, situation. There may be the same thing with a vulnerable population like children or adolescents who are struggling and may have an escalated situation where parents may call law enforcement. People experience things like job losses or the unexpected death of somebody that's important to them. And these things are all crises, right? On the other sort of side of the spectrum, you have what we often hear most about, and that would be untreated, usually severe mental health conditions where people are in crisis and maybe experiencing some higher level sort of acuity of symptomology or symptoms, which might be delusional thinking, hearing voices, people commanding certain kinds of behaviors. And those are the kinds of mental and behavioral health crisis calls that often pose a higher risk for ending in outcomes that are tragic for everyone.
And let me ask you a specific question on that. Are people who are experiencing a mental health crisis more dangerous than others?
So the national statistics on that are no. Most persons who are in crisis that have untreated mental health conditions are more likely, in fact, 16 times more likely to be victimized, which is one of the reasons why the less we can have people involved in the criminal justice system and in environments like jails. The better. People are in environments that have a lot of trauma and that pose additional risks for people to be victimized.
And so just describe for us, what are some of the challenges that a police officer faces when responding to one of these calls?
Well, there's a lot of challenges. One of them is that law enforcement didn't go into this business with mental health training. And so that's one of the areas that we'll talk a lot more about. A broader system, issue that communities all over the country need to be addressing is that our default system for crisis is 911. And there are a lot of reasons that go into that are problematic. But law enforcement response, when we call 911, we're expected to receive a police response.
So tell us generally, what would an effective response system look like? What are its elements?
Well, I think I'd like to sort of back up and talk a little bit about communities often operate in silos. So the police department is doing their work and they're good at it. Community mental health centers are doing their work and by and large are good at it. The jails are doing their work and they're largely good at what each of us do. Most of the time, we're not communicating with one another. We're not sharing data. We're not understanding each other's system gaps. We're not understanding what's working well, what's not, why certain organizations have specific policies or procedures that govern the operations of each of those entities. So I would say part of the barrier that we have in communities is that we're operating in silos, and we need to do a much better job of operating out of a space of collaboration. And so, I like to refer to that as an ecosystem approach. And what I mean by that is that it takes key entities that are all involved in response to people who are in mental health crisis to come together, not to point fingers at what each of us are doing wrong, right? Because all of us have, a part to play, but instead to come together to talk about what isn't working, what is working. And so where do we need to sort of align our efforts in a collaborative space to be able to begin to identify and address those system gaps.
And that's really the issue we'll ultimately want to talk about. But before we get there, just to walk through the basics, tell us what a call for service looks like. How does it start, and what should happen in the course of the police response?
So I want to start out and emphasize again that unfortunately in our country, 911 is the default system. And so I think from a higher level, we have in our country a broken mental health system. And, you know, we could talk about all of the historical reasons for that, but I don't think there's anybody that would be listening to this that would disagree with that. There are under-resourced.
And I'm sorry to interrupt you, but it sounds like the problem we have on a lot of areas in society, there's a problem. We just ask, we give it to the police to handle.
That's it. That's exactly it. That's exactly it. And, you know, all of us, and I don't think, is there anyone in America that doesn't know what 911 is, right? That is our default system. So when we have a crisis that needs an immediate response, we are trained, well trained, to call 911. And we are also, we know that there is a 24/7, 365 response by our law enforcement partners. And in community mental health, it is fairly rare that you have a response that is timely, 24/7, and with the resources to be able to resolve the situation either on scene in the home or community, but also when it's necessary to transport somebody. Those resources are often not accessible in the same way that 911 and law enforcement response is. So on a more global level, we as a community have to do a better job of making a shift away from the known 911 call for that, sort of resolution, and into educating and developing resources that better substitute, wherever appropriate, that need.
All right, so we're the family or someone calls 911. What happens? What should happen in response?
Okay, so what does happen and what should happen might be two different responses depending on the community. So let me start by first, what typically happens is someone calls 911. 911 does a standard triage of what the situation is, and then dispatches an officer to a scene. That's what typically happens in most communities. What we want to happen in communities is that when a family member or a community member determines that 911 is the place that they're calling or that they believe they need, we want call takers and dispatchers, or telecommunicators is what that's typically called, to be able to first be trained, right? A lot of telecommunicators aren't even trained in common signs and symptoms of mental health conditions. What are the sort of critical questions to ask whoever is on the call? Things like, what might be their triggers? Do they have a diagnosable, mental health condition? Are they on medications? Do these individuals tend to have violent tendencies? Are there weapons in the home? If so, what kinds of weapons? Like, these are all critical data points for responding officers to have. An officer is going to go into a scene in a more escalated manner if certain checkboxes of those are, identified, where they might go in a very different, lower sort of response if some of those checkboxes aren't there. So we want our call takers and dispatchers to be first trained. The second.
We want them to know what questions to ask, so the officer gets the information that they need when they arrive on the scene.
That's correct. And operationally, we also want them to be able to both put it in the PDT, the portable data terminal, so that it's on the screen in the officer's car. But we also want their policy to say that same information needs to be verbally said over the air. So, you know, there should be a dual point that way for those key factors, you know, to be transmitted to responding officers.
And when the officer arrives on the scene, what do we need them to be able to do to effectively handle one of these situations?
So an officer is, we want to be, first of all officers, we want to be well-trained on the same kinds of issues, common signs and symptoms of mental health conditions. You know, what are the best ways to interact with someone who might be in a mental health crisis? You know, some of those things are really important to slow things down, right? When someone rushes up on a scenario that, you know, you getting in someone's personal space who is in crisis can escalate the situation. You know, if there is a weapon or a perceived weapon in that scenario and an officer sort of rushes in too close to a scenario, to the situation, it, you know, it tends to escalate the situation, and sometimes in a manner in which lethal force is justified. You know, we want officers to have good verbal communication skills. We want the physical presence of somebody, of an officer coming on scene. We want, for instance, if they're wearing sunglasses, to be able to take off sunglasses and to make eye contact. We want, you know, tone of voice to be a lowered, more engaged tone of voice. We want officers not resting their hands on their firearm. You know, we want officers to be able to ask questions in a way to gather more information, as opposed to, for instance, shouting commands. We want lights and sirens turned down whenever possible to avoid distractions, which can be, especially when someone may be hearing voices, escalating a situation. So if it's safe to do so, to turn down lights and sirens, and turn down their audio that they wear on their uniform. So there are a lot of different things that go into appropriate training to allow officers to have the sort of environment for a de-escalated situation. There is a term that's often used that distance plus cover equals time. And so, you know, what we mean by that is when you give enough distance between you and the person in crisis, it tends to not escalate, but de-escalate a situation, because people aren't feeling threatened on both sides. Both the officer and the person in crisis are not feeling, you know, as threatened. Cover, when we talk about having a backup officer that may be en route or on scene that is providing cover, there are ways to use, you know, vehicle doors or buildings to be able to provide additional cover, you know, so there is not such an escalated, you know, fear of unsafe conditions. And that both of those things buy time. And, you know, part of time is to increase the opportunity for continued de-escalation strategies and tactics to be deployed, and also to be able to call in other specialized resources. You know, so communities may have, maybe it isn't a CIT officer on scene, but a CIT officer can be called to respond. Some departments have co-responder teams, so you might have a clinician and an officer paired together, being able to call in that kind of a specialized, you know, backup response. Some communities have mobile crisis teams that are just clinicians within their community mental health centers, and buying time to be able to call in those resources to help, you know, improve the likelihood of a de-escalated situation are all things that we would want officers to be equipped with coming onto a scene.
So Julie, you're really illustrating what we hope our mission is, because you're already demystifying the elements of safe and effective responses to these situations, and telling the secrets, that there are a list of things that we know officers if they're able to do them effectively, will likely promote better outcomes. But one of the things you just touched on is that there are other resources available to officers. We don't need to have a situation where just the officer is there alone. You talked about CIT. So first, just tell us what that stands for. And then if you could just briefly touch on some of the models that are used to help officers respond to these situations.
Sure. So crisis intervention team training, or CIT training, is one of the most well-known trainings across the country. There are others as well, but the CIT training, crisis intervention team training, was developed out of Memphis, the Memphis community, after an officer-involved fatality back in 1988. So the model has been around a long time. It was developed as a voluntary model. So you had officers that only had an expressed interest in wanting to be identified as a CIT officer responding to calls involving a mental health component. So in the Memphis model, officers would be filling out applications identifying why they're interested in being a designated or certified CIT officer. They would have a demonstrated skill set in being able to de-escalate these kinds of crisis calls. You know, oftentimes there might be personal experience that an officer brings to that. You know, they have their own family or you know, other situation that has given them a keen interest in wanting to be responding to these kinds of calls. So in the Memphis model, you know, typically it would be that you sort of have enough CIT officers in each shift and in each district to be able to respond to the percentage of number of calls for service that involve a mental health component. So in terms of the Memphis model, that's kind of how it is designed. It's a 40-hour training, largely taught by community members. You know, community subject matter experts that are, you know, able to talk about psychotropic medications and common signs and symptoms of mental health conditions, you know, specific to drug abuse issues. You know, there's a lot of different community members that make up this 40-hour training. Law enforcement typically does train a couple of the sessions, but it's mostly known for the community because the reason crisis intervention teams are so successful is because it comes back to that ecosystem. It isn't just a law enforcement training. It is a community ecosystem training. And part of that model is that you have law enforcement then learning about what are the community resources that are available, right? So oftentimes you go do day trips to the crisis centers or, you know, to the community mental health center resources that are in the area. So it's a very popular model. One of the things that has evolved in 21st century policing over the last, you know, maybe decade has been that departments around the country that started maybe as a traditional CIT program has seen the benefits of it in so many different ways. And so you have had police leadership who has said, well, why wouldn't we want all of our officers to receive this kind of intense training? And so there's been an increased sort of movement within the law enforcement community to move from a voluntary model, which is what the Memphis model is, to a mandated model. Where they're putting all of their officers through this 40-hour training. There are a lot of benefits and drawbacks to that transition to a mandated model. And so what I always like to encourage communities to look at is that if your department or your community decides that that is a model that you feel is appropriate for your community, that becomes sort of the floor. So all officers are sort of then receiving an intense amount of training as their floor. And then that there's sort of a bumped up or elevated cadre of officers who would be more of the traditional voluntary, right? So then it's those officers who are completing an application that are really receiving elevated training. So it's very common that you have advanced CIT training that may be focused on, for example, youth, interactions with youth, or interactions with veterans. And so it would be that voluntary cadre of officers that would be receiving extra training, and it would be them that are the ones prioritized typically to higher levels calls for service. So I always like to say, the more robust training you can provide to all officers, generally the better, because all officers are going to respond to crisis calls, all of them. And so the more equipped we can have all officers, the better. And we also expect that when a community member is asking for a CIT officer, that community member rightfully should expect an officer who wants to do this, who has the skill set to do it. And that sort of elevated, specialized response would typically be wearing, a CIT pin or a badge that identifies themselves as a specialized response, that are highly trained to respond to these kinds of calls.
Great. You also mentioned a co-responder model. Tell us a little bit about that.
Yeah, so there's a lot of different models that have evolved around the country. And I always encourage communities to sort of explore those different models and then kind of think through with your key stakeholders, which models might be best for your own community. But there are what would be traditional co-responder models, which are typically a CIT or specialized, trained officer paired with a clinician. And those co-responder models would be riding out together. So, when there is a 911 call that comes in that's identified as a mental health related call, that it would be the co-responder units, the clinician and officer that would be responding to those calls. A lot of communities, the higher frequency utilizers of 911 services, these co-responder teams are often designated as the teams that would be providing proactive services. So we know someone, who is calling 911 all the time that we know has a mental health component. And so it would be those co-responder teams that are all, also doing proactive outreach. But there are other, sort of unique non-law enforcement based teams, that include combinations of paramedics, peer or people with lived experience, clinicians, case managers, where in different communities, the different models have, worked in different ways. But in those models, it's often, this is another component, switching back to the 911, dispatch center, that there has to be an effective sort of function to be able to divert those calls that still come in to a 911 center, to be able to identify it as maybe not needing law enforcement response. And so being able to then divert those calls to a non-law enforcement based, co-responder or alternative response. That's oftentimes how it's differentiated, because many communities, when you hear co-responder, it is law enforcement clinician based. So alternative response programs that maybe don't involve law enforcement are increasingly growing around the country with very positive outcomes.
And you also mentioned mobile crisis teams.
Yeah.
Tell us about those.
So mobile crisis teams, again, those can look different in different communities, but are often connected to the community mental health center. So, many families who receive, services through a community mental health center, may know that they can call a crisis line. Most community mental health centers have some kind of crisis line or crisis access. And typically, mobile crisis teams would be clinicians and case managers that are, that are within the community mental health center that are able to then sort of triage. These are calls that I can go out on, without law enforcement. And so they would be, responding and, and resolving situations. There's also teams that are street outreach teams that, are typically often through the community mental health center as well. But, they would be in areas where there are high calls for service, typically by law enforcement, that, can effectively be engaged without police in a proactive way. So there's just some increasing creative and necessary programs that are happening around the country to help reduce law enforcement response when it's not needed. There are always going to be calls that involve law enforcement that need to involve law enforcement. And that's one of the reasons why I always like to strongly advocate for communities to ensure their police departments are receiving robust training and not a one and done training. Like, these are trainings that have to be ongoing. So, if you have a 40-hour CIT training, well, you have to then on an annual basis be doing some kind of refresher training. Some are able to be done in an e-learning. There's companies out there that have pretty good e-learnings as part of an ongoing, refresher training. But it's really important that at all levels, at the recruit academy, when officers are first being trained in academy, you've got to have robust training so that when they're coming out onto the force, they're already exposed to this important, information. Then it's the sort of annual in-service training. So all officers across the country, states have requirements on annual in-service training hours. And so, there should always be training associated with crisis response, mental and behavioral health crisis, de-escalation, active communication skills. That should be really integrated, across training. One of the things that I always like to say is departments all over the country do a great job training on force, how to appropriately use force, and that is crucially important training. I don't ever want to say that isn't important, because we want officers to be able to appropriately use tiered force when force is justified. So we've got all sorts of layers around, OC spray or tasers or batons or, worst case scenario firearms. But what departments all around the country often don't do is an equal amount of training on de-escalation and communication and how we engage and build trust with our communities. And that training is equally important to changing the culture of how this ecosystem respects one another, engages one another, and improves outcomes. So I always like to talk about, all departments have annual qualifications on firearms. If you carry a taser, you have to annually certify for taser. Those are important things, but we don't have the same annual certification of effective de-escalation skills, of, effective communication skills. And so we must build a culture in our departments around the country of valuing that and having accountability for that, in the same way we do with ensuring that officers are using the least amount of force as possible in environments that they determine force is needed.
All right. So you've told us a little about the challenges, what the needs are, and some elements about the training. So how do we get from where we are to where we need to be? What would you tell people who want to help drive change in their community? Where should they start? What should they do? What can they do?
Yeah, that's a great question. And I love that question, because change can happen in small ways. And change can happen with few people at the table. And so I always encourage communities to find some key stakeholders who are passionate about this topic. Sometimes those stakeholders are a parent, a person with lived experience. Sometimes they're an advocacy group like NAMI, who is in every state around the country. Sometimes it's NAMI. Thank you. NAMI is the National Alliance on Mental Illness. So, and they're a strong advocacy group that are very helpful with CIT trainings around the country as well. Very engaged in this topic. Sometimes you have a sheriff or a police chief or someone on the department, a police department or in the sheriff's office that have their own personal experience. In my own work on the ground, we had a high-ranked person within our police department who had a brother who was living with schizophrenia, and he was passionate about this work. He became our advocate through the police department. We had our sheriff who had a concern with his son in the same, mental and behavioral health space, and he became a passionate advocate. So, it doesn't have to be high-ranked people, but it helps when you can find a partner or a stakeholder that is passionate. County commissioners, legislators. There are people who are very interested and powerful resources that can be a part of this ecosystem. Doesn't have to be, but can be. So I would encourage communities to pull together even a small number of interested stakeholders and begin the dialogue first. Part of the dialogue should be about finding answers. So, for instance, many communities don't know if their police department are even tracking mental health calls. So, police departments, typically they have call or clear codes. So, there will be a code that if a person or a family member calls or what have you, there are call or clear codes that are associated with calls for service. Some communities may not have them that are associated with mental health calls. It's a great question to start asking of your, police department. Some have the call or clear codes, but just aren't using them in any kind of reliable way. So data that's produced may not be reliable. And so that data needs to be strengthened. There needs to be conversations within the police department. When you have an effective or reliable code in your department, well, that's going to help you determine in what districts are the highest calls for service, in what shift. That helps to inform where you maybe start prioritizing the greatest number of services. So there's great data that can come from each of the entities. With the police department, the other thing that, depending on communities, if you have good crisis center services, if you have 24/7 law enforcement drop-off services, is the crisis center requiring law enforcement to fill out a little bit of information so you can start tracking from the crisis center which of these drop-offs are from law enforcement. What are the hours and days in which there is the most frequency in drop-offs, right? So there's a lot of data related areas to start. But I do want to just mention, as we, sort of as people coming together, beginning these conversations, I like to always give a couple of examples that help root the concepts into maybe things that make a little more sense. And this particular point comes back to economics, because money talks in communities, right? In my own work, we started with our CIT program, and communities have to think about where it makes the most sense for them to start. But for us, we started with our CIT program within our police department. What we learned very quickly is that we can train our officers all day long. But if they don't have some place to take people, what's the point? Right? I mean, what is the point? And then they get frustrated and then it all falls apart. So you have to have somewhere other than jail to bring somebody that is in crisis. And it has to be easier than booking them into the jail. If it takes 10 minutes to book someone into the jail and it takes 45 minutes to bring someone to a crisis center, that's not going to work. So, you have to be able to start looking at system issues. From an economic standpoint, we ended up embedding crisis case managers inside our jail from the community mental health center, which is where I worked. Those case managers every day cross-checked the daily jail booking report with our active client base within our community mental health center. Out of that, they were able to identify which of our active clients are being booked into the jail for what crime and how long are they staying. What we found out of that is that almost 80% of the jail bookings of our clients from the mental health center were being booked in on low-level city ordinance or minor misdemeanor crimes. So in our case at that time, it was $92 a day to be in the jail. We quickly were able to calculate if you spent 4 days in jail for a urinating in public charge times $92 a day, and you're one of this many clients, we were able to take that dollar amount to our county commission and to our sheriff. And a year later, we were able to demonstrate the savings to enough of a degree that the sheriff decided to pay for the program. So, there are, I guess, what I want to say in that is that starting anywhere and the crucialness of data can really help inform where your gaps are and where you need to go.
Okay, so there's potential a lot to work with, but I'm going to ask you, if I wanted to start, it's just me,
Yes.
Tell me 3 or 4 things that I could do at the conclusion of this instruction to begin the process in my community.
Okay, so start with building a small team of people who want the same thing. That's the first thing that I would say is look around and find, even if it's 3, 4 other people that are, I encourage there to be, some of the stakeholders that we've talked about. That would be the ideal space. If you can sit in your living room and talk about, what are our system gaps that we know of, right? What are the areas that we know in our community are problematic? I experience all over the country, people get so overwhelmed by the system issues. The system is broken. So, when you start to think about all the barriers in the mental health system, the police department, the jails, everywhere else, lack of resources, communities always say, we don't have the money to pay for these things. I always encourage communities to just start somewhere, anywhere. And then I call it the archaeological dig, because you start somewhere and you start gathering a little bit of data, and that data brushes off whatever the next thing is going to be. You don't have to have the whole system figured out. In fact, I would encourage people not to have the whole system figured out, because the small steps are going to tell you what the next step should be. And so I really encourage communities to start there. The other thing that I would always encourage communities that have an interest in this is there is a model called the sequential intercept model. And that model identifies basically 5 places in which you can intercept people out of the criminal justice system and back into community-based care. And I'll talk very briefly about each of them because it puts it into context. The intercept 0, which was actually added later, than the model originally proposed. But Intercept Zero is all on the prevention side. It's all pre-911. So it's about really focusing on what are those services that are missing? You know, how are our hotlines? How are our crisis services to help address crises before they happen, right? In the community mental health center, I oversaw our emergency stabilization services. I knew who our top 20 to 30 people were that were in big crisis. So, you know, being able to really focus some efforts on that Intercept Zero is really important. There's suicide hotlines. There are all kinds of hotlines that that need to be utilized pre-911. The second intercept, or it's Intercept One, is really where at the point of the 911 call. So we have to spend some time having call takers, as we were talking about earlier, being able to identify a mental health call, being able to have a warm transfer wherever it's appropriate to the non-law enforcement response. So if a call taker is educated on what the resources are, that they can be able to identify, you know, this person really needs help with identifying housing resources or identifying, you know, clothing resources. There are other nonprofit organizations that's where they specialize, right? So being able to build in some infrastructure into the 911 call center is just one area that would be considered under the Intercept One. You know, the Intercept 2 and 3 are really around jail diversion programming. We talked a little bit about that already. And backing up under Intercept 1 is the 911 response by law enforcement as well. So those co-responder teams, the CIT officers, all of the police response-based programs, you know, are also included under that Intercept 1. You know, when you get to the Intercepts 4 and 5, it's all about post-discharge from jails and prisons. And that's an area where we often miss, because if there is not a warm handoff out of jail, out of prison, back into community-based treatment, medication services, case management services, linking to job services, linking to housing services, that individual is going to be right back in the system. The data tells us that. So I would encourage community members to pull up that Intercept model. I think we'll include that in our community guide. So that's something that will be a resource for people to grab from there. But a simple Google search will pull it up too. And that is a terrific resource for interested people to look at and to give sort of a platform for having the conversation with their community stakeholders about what's next.
You mentioned the community guide, so that's a nice segue. What were you referring to?
So the community guide goes into this topic in a much deeper way, and I would encourage community members. This will be something that's linked to Effective Law Enforcement for All and available on the website for interested members to be able to read and use in any way that that best suits their own community. So it goes into this topic in a much deeper way.
That's great. So let me see what I've learned. If I can, if I understand you, the takeaways here, if I want to create change in my community, I first just start with people who share my concerns and also want to make a difference. I guess we would expand that circle to find those others who share that concern and perhaps have information and data that we would need to help understand the situation in our community. Then go and find allies and others who are stakeholders in this ecosystem that you've described and try and drive a dialogue among all those groups dedicated to trying to improve how our police departments are trained and equipped to respond to individuals experiencing a mental health crisis. Did I learn?
You got it. And I'll add one more thing to that I should have said earlier on. And that is the importance of getting people at the table that are not going to blame and point fingers at other entities. That will break everything apart. I like to always envision the river, and the river is just go with the flow of who is working collaboratively together for the same mission and purpose, and who recognize that all of us have a role in some of the system barriers. So I know in my own work, when I was overseeing our emergency stabilization services, I had system gaps and failures that were creating barriers for other people. I had to be able to say, yep, that's my area. I gotta own it and I've got to fix it. So having people at the table that aren't just going to point at, the police department's the issue, the jail's the issue, the mental health center is the issue, but are really going to come together in a collaborative space and putting egos aside to be able to address the system gaps. There are always going to be people who are throwing the boulders into the river, and do the best you can to let the boulder go and to work with the flow of the advocates that are working in the right direction. Ultimately, in a successful system, you're going to have enough positive outcomes through this process that the boulder or boulders are going to end up getting pressure to come on board or be moved out of that process.
But the
So
river,
instead of
the river washes away the boulder.
that is
makes it a
exactly
small
right.
stone.
That's exactly right.
Julie, one of the things I wanted to ask you about, we talk about the harm to the individual experiencing the crisis, but these situations can also be traumatic for the officers as well. Isn't that fair?
That's very fair. And I think that's often overlooked. I think many people that are listening to this probably know that 1 in 5 officer involved fatalities involve a person in severe mental health crisis. That is too high, and that is traumatic to everyone involved. It's traumatic to the person who lost their life. It's traumatic to the friends and family of that person. And it's traumatic for the officer who just took someone's life. Officers have a hard job, and a lot of the data plays out supporting that. Suicide rates are exceptionally high among law enforcement. Divorce, alcohol and drug addiction, very high among law enforcement. And so it's not an excuse of behavior that may have happened in an inappropriate scenario, but it's important to remember that this is a traumatic outcome for everyone.
Yeah, and so when we talk about effective mental health crisis response, we're talking not just about protecting the individual experiencing the crisis or family, but officers as well.
Officers as well. And it's important to remember that most officers, like most social workers, went into the field to help people. They didn't go into the field to harm people.
Exactly right. And we owe it to them to give them the tools, the training, the resources they need to do their job that we have asked them to do.
That is exactly right. And to reduce the need for them to provide that service when it can be provided by people who were trained to do that. So, yeah.
Thank you so much. This has been tremendously educational. I'll urge viewers, please go to our website to look at our community guide. You can also contact us for information, and good luck to all of you in working together to achieve police practices that are safe and effective for police and the communities they serve. On behalf of Effective Law Enforcement for All, we hope you found this this class valuable. Thank you.